Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal Capital Territory Administration bars unvaccinated workers and visitors access into premises. More residents in Anambra turn out to get vaccinated as state ramps up sensitization efforts in ongoing mass vaccination drive. And doctors and nurses at the Children's Hospital in Augusta, Georgia, record huge spike in Omicron cases as the variant rages across the United States. Thank you for joining us. According to the COVID-19 situation report for week 65 from the 3rd to the 9th of January this year, a total of 57,046 tests, including RDTs and PCRs, were carried out. While the Nigeria Center for Disease Control also reports that the number of new confirmed cases decreased to 8.5% from 10.4% reported in 30 states and the FCT. It says that active case finding and contact tracing is ongoing in 15 states. Here's more on the pandemic update.
301 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT, indicating an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 175 infections. Ondo had 42, Osun 23, Rivers 21, while Nasarawa registered 16 cases. Oyo, Gombe, Kaduna, Kano and FCT logged a single-digit infection. The total confirmed cases in Nigeria now stands at 250,929. The report also includes a backlog of confirmed cases and deaths from Lagos State, as well as 0 cases from Abia, Bauchi, Plateau and Sokoto states. 287 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 224,052. There were 8 additional deaths recorded in the last 24 hours, raising the fatality total to 3,103. A little above 10% of eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while 4.4% of the population have been fully vaccinated. The total global confirmed cases have surpassed 328 million, while deaths are beyond 5.5 million.
The Federal Capital Territory Administration, FCTA, has commenced enforcement of the no vaccination card or proof of negative test result, no entry into public facilities order. The enforcement exercise comes more than a month after the federal government began the enforcement of same in December last year. Our correspondent, Emperor Simon, reports.
Staff of the federal government hanging around the premises of the Federal Capital Territory Administration Secretariat at the Garki Area 11 part of the nation's capital. On a normal day, they should be in their offices at the early hours of the day, but security men are manning the gate of the facility to enforce the directive by the FCT administration that only persons with COVID-19 vaccination card or proof of COVID-19 negative test result obtained within 72 hours can be allowed access. Every person is required to show their vaccination card and identity card before they are allowed entry, and those without the documents are turned back.
The federal government have announced this late last year. FCTA commenced its own enforcement after giving due time, and some persons we are not vaccinated here. And we felt that was not right. Even if you're not going to be vaccinated and you feel that, then get us a negative COVID test result. Across FCTA-owned offices here, if you are not vaccinated, you don't have a COVID-19 negative test result, then you won't be allowed in.
However, some of the civil servants claim they were not adequately notified.
We are not being informed. So for us to come here this morning to see this kind of situation, we are very, very surprised. So they should just give us some time so that we can get ourselves prepared for it.
But the aide to the FCT minister debunks the claim.
If you check all the media houses, the circular was carried last year by the Office of the Head of Civil Service of the Federation to all federal civil servants, of which the FCTA is part of it. The FCT minister, the FCTA, through the permanent secretary and the Director of Human Resource, issued a circular again on Sunday and Monday, which was sent around all of them and carried again in the media, heavily reported.
As the exercise continues, some of the civil servants are, however, taking advantage of the mass vaccination exercise going on just meters away from the Secretariat. The Federal Capital Territory has the second highest figure of COVID-19 cases in Nigeria, with over 27,000 confirmed cases and 241 deaths recorded as at January 17, 2022. Emperor Simon, Channels Television News.
And since the inception of the third phase of COVID-19 mass vaccination in December to protect the people of Anambra State from the virus, even as the Omicron variant is currently circulating, many vaccination centers created have been very active in the state. According to the Executive Secretary of the Anambra State Primary Healthcare Development Agency, the exercise, which would have ended on January the 6th, has been extended so that much more people can be captured in the vaccination exercise.
Many states have adopted several strategies of taking the vaccines closer to the people, including mass vaccination campaigns aimed at increasing the COVID-19 vaccine uptake. That's the situation at the Children's Welfare Clinic section of the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amok, in Awka, the Anambra State capital. Health officials here are using the opportunity to enlighten residents who have come for treatment on the need to dispel vaccination myths and get vaccinated. Some of those who received the vaccines share their experiences.
After taking the vaccine, I saw something different entirely, because the way people were talking about it in the time past and what I saw right now that I've taken the vaccine is not the same thing. The vaccine is not harmful.
I'm very okay. I'm not feeling anything at all. So from what people were saying, initially I was skeptical about taking it because of all I've heard. But right now I'm not feeling anything. I'm still the same.
The state says it has also expanded its vaccination sites and scaled up operations to allow for more accessibility to the vaccines.
So here we are monitoring the COVID-19 mass vaccination, which we started first week of December, and we have extended it into January, where we are targeting the rest of the population.
Health workers at the Nkwuamenyi Market Center are here to amplify the importance of getting vaccinated, and more people appear to be presenting themselves for the exercise.
People are turning up, as I did not expect. People, there are no more rejecting COVID-19 vaccine again. People are happy, we are happy, coming out freely.
The Maternal and Child Health Clinic at Amobia is one of the vaccination centers, but officials here say that the road network to gain access to the area has posed a challenge.
For people to come in here to vaccinate, at times they are being blocked, they are being denied to access healthcare services here. Not only the people that are taking the COVID-19 vaccine, other clients that want to come here to access healthcare services, they are suffering.
The state government says it expected that its accelerated vaccination efforts will reach a large percentage of its targeted eligible population.
And that's how it's going there in Anambra State. Well, as the more infectious Omicron variant of the coronavirus triggers an unprecedented surge in cases around the world, the World Health Organization has added 2 more drugs to its guidelines for recommended treatments for COVID-19. They are baricitinib and also for sitrovimab. That's a conditional recommendation. Well, to talk more about these new drugs, the latest to us, joining us in the studio here in Lagos is Mr. Peter Ogini. He's a chief pharmacist with FMC Lagos. Thank you for joining us on the program.
Yeah, thank you.
So let's begin. How do the new drugs work against COVID-19?
Yeah, the new drugs, it's a thing of joy that the World Health Organization come up with a trial if you look at the ravaging of the COVID-19, a lot of people died, and not many people were ready to take the vaccine. And with this new drug development, it has gone through stages, or you call phases of testing for most of drugs that are developed. You have phase 1, phase 2, phase 3, phase 4. And most of the drugs that are available now, you'll find out that they are oral drugs compared to the vaccines that they have to invade the patient. Not many people, like such invasion. They are averse to it. So,
the needles.
Yeah, yes. So with the tablets that are being, produced right now, which is being pioneered by the World Health, it brings succor. And again, it will help in reducing the number of people and patients who perhaps don't want to, access the treatment.
So these new drugs, do they apply to, is it the more severe cases, moderate cases of COVID-19?
Moderate to, just mild to moderate. Because if it is severe, then it becomes, maybe a hospitalization thing. And some of these drugs reduce hospitalization and death. Like you have, Sotrovimab and Paxlovid. Paxlovid is made by Pfizer, while the other one is by GSK. And they've all pioneered their research such that the side effect and the hospitalization period is reduced. For the Sotrovimab, you are talking of like maybe 79% reduction in hospitalization and death. While the Pfizer product, which is the Rotanova, which is branded as Paxlovid, it is about 90%. Merck also has their own product, which is Molnupiravir, and the Molnupiravir is just as good, but the side effects are more compared to that of the Pfizer.
But we also know that some of these drugs are coming out and the trials done essentially tackles Delta variant. But what about the Omicron variant of COVID-19?
Omicron variant is a new variant. And the thing about the virus is that it keeps mutating. And because it keeps mutating, it is difficult to trap. But with the drug they have developed now, it is easy for people who want to access treatment to get treated because of the research that has been done on those drugs and the phases of trial that it has gone through. In the most drug trials, you have phase 1, which you test with animals. Phase 2, you test for safety. Is it safe for human? Then the phase 3, you talk of the efficacy. Is it efficacious? And these new drugs have gone through the phases. So if they have gone through the phases and the World Health consider it fit for managing the COVID-19, I think it's a plus for the World Health.
My last question is, any adverse reactions, and then how will the rest of the world get it? Because we know how, vaccines have not gotten to, enough vaccines haven't gotten to some parts of the world.
Yeah, that's what I'm saying now. The issue of safety has been tested, so it is safe, and it is simple oral, a tablet. So getting to the world is left for the government to do sensitization. Even in our country, Nigeria, I think, what do you call it, National Orientation Agency, I don't think they have done much in the sense that if the National Orientation Agency come out captions, radio captions and other areas where they can sensitize the public, then people, the withdrawal that you have, people not getting ready, not making themselves ready to take this, will not be there.
And also that applies to vaccination as well, because this will have to be recommended by a physician. Yes,
it has to be recommended because they are prescription drugs. But you see, the thing with some of these drugs is that they are emergency drugs. And with all the emergency drugs, some of them are toxic. And because they're emergency, the FDA will have given authorization that those drugs should be produced because you have an emergency situation that has to be taken care of.
All right, we appreciate your time. Thank you so much, Mr. Peter Ogeni, Chief Pharmacist, FMC Lagos. Thank you for joining us on the program.
Thank you very much.
Still ahead, children at risk following Omicron surge in the US. We have more on that story and more when we return. Welcome back. The Director of Disease Control and Immunization under the Edo State Primary Healthcare Development Agency has called on members of the public to take advantage of the mass vaccination arrangements the state has adopted to get vaccinated. According to him, compliance level has not been encouraging in spite of the increase in the number of vaccination points spread across the state.
We have different segments of activities. We have the mass vaccination teams, which are like mobile teams that are discharged from the agency every morning. And we have about 13 teams that go out. A team is about 5 persons, and that tells you the number, 5 times 13, every morning, all the logistic needs and the other support that is required for the successful outing are provided, and these teams are taken to different sections of different parts of the state capital, and where they mount vaccination posts and then undertake vaccination activity. It doesn't have to even be like just COVID-19 vaccination or the COVID-19 vaccines alone. All other vaccines are integrated into this activity, and these sites move from place to place. We also have another segment called, we have them strictly fixed posts, and these fixed posts, we also have them spread across the state, but majorly in the city, and these sites are the high traffic big chains, pharmaceutical chains, and the eateries, big companies, banks that are well patronized. We have our mass vaccination sites there.
Away from Nigeria, doctors and nurses at the Children's Hospital of Georgia in Augusta have noticed a huge spike in the number of Omicron cases among children as the variant rages across the U.S. Children below the age of 5 who are not eligible to receive a vaccine remain at high risk of catching the virus as a result. While children show milder symptoms, the sudden jump in cases among the young has overwhelmed hospitals and clinics. Doctors say it is too early to determine whether Omicron causes more severe illness in children than other variants of the coronavirus, but that its extremely high transmissibility is one key factor that is driving up hospitalization. Last week, the U.S. broke a global record for the number of new coronavirus infections in a day, reporting 1.35 million cases on Monday, the highest daily total for any country in the world. Well, joining us to talk more about the situation in the U.S., our Washington correspondent, Maria Burt, joins us now. Hi, Maria. I mean, that's happening in Georgia. Is that the same thing as in other parts of the country, the spike in the number of Omicron cases among children?
You know, this is something I think there are certain regions, obviously, that are what we consider hotbeds and hot pockets of the coronavirus. And it just depends on exactly what's occurring in that state, especially with the various mandates and policies that could be in place. So you do see quite a bit in the southern regions and in the Midwest. More so than you will in the west or the northeastern regions of the U.S. And that's just due to the various ways in which local governments are handling the virus. But again, we are across the board seeing a spike in children with the COVID-19, especially with this highly transmittable, as you stated before, Omicron variant. A lot of that is the children are now in school. They're now together in social settings. And so because this variant is so transmittable so quickly, they are becoming more likely to contract it than they did in the other variants. But the greatest concern, as you mentioned before, are those children under the age of 5 who are not eligible for vaccines. But we also still have a large number of children between 5 and 12 who are eligible for vaccines, who parents have not felt comfortable enough yet to provide them with the vaccine. And so that is another group that is even at great risk for contracting the virus.
So quite a number of things, a number of factors going on. But in terms of the demography and with the surge the U.S. is experiencing, which particular group would you say is more affected, especially by the Omicron? Is it the children, the adults, more men than women?
Unfortunately, those individuals who are not vaccinated are the ones that are at great risk at this time. We do know, and the CDC is now working very hard to try to convince people that just because we know the Omicron variant is highly contractable and transmittable, and it has not proven to be as severe as the Delta variant and other variants of the virus, that does not mean that you should be relaxed, because we have seen quite a few individuals who have been vaccinated still coming up positive with COVID-19 with no symptoms as the result of the Omicron variant. But that does not mean that people should become lax due to the fact that they are seeing many individuals that are asymptomatic with this new variant. And so we are seeing a greater number of cases, but the severity of the actual symptoms and those hospitalizations are still heavily tied to the Delta variant, unless, as we said before, those individuals are unvaccinated. Those are the most vulnerable group. The ones that are unvaccinated are the ones that we're seeing that are having the greatest impact of this new variant.
All right, talk to us about the use of the home COVID testing. I mean, lots of people on Twitter say that swabbing your throat in addition to your nose may be a better way of using the COVID-19 test kits to detect the Omicron, particularly now, the Omicron variant. I mean, is there any uncertainty, or why the back and forth with that?
The experts are saying that that is not the appropriate way to use the home test kits. The swabbing of the throat is not the appropriate way. And so they are still encouraging, and they're asking and requesting that individuals continue to use the nasal swabbing for those home test kits. We're now finding ourselves to be in a great ability to be able to have these home test kits available, whether or not they pick them up from their local libraries or schools are providing access to them. And now even the government is saying you can go and request a kit and it will be sent directly to your home. Just trying to get people more actively engaged and proactive about knowing their status as it relates to the virus.
Miriam Bird, our Washington correspondent, many thanks. And the Pacific island of Tonga is concerned that international response could bring coronavirus to the COVID-free nation. Now, an underwater volcano in the South Pacific erupted violently on Saturday, causing tsunamis to hit Hawaii, Japan, and Tonga's largest island, Tonga Tapu, sending waves flooding into the capital. It is unclear how bad things are as the disaster has affected communications there. Here's more on our COVID-19 global update.
The underwater volcano of Tonga erupted on Friday, sending thick plumes of ash and smoke into the sky, a day before erupting again to trigger a tsunami on the island nation. Dramatic footage showed black clouds of volcanic ash exploding amid tall columns of smoke during Friday's eruption. While communication lines are down and significant damage caused, Tonga officials say they do not want to bring in another wave, a tsunami of COVID-19. They are appealing for patience while priorities for aid are decided. Aid sent to Tonga will need to be quarantined, and foreign personnel would likely not be allowed to leave the aircraft. In France, health expert Arnaud Fontenay says the country has avoided the worst-case scenario in the COVID-19 wave brought by the Omicron variant. As the country is moving past the peak of its latest episode in the pandemic, the epidemiologist at the Institut Pasteur and member of France's Scientific Council says the Paris region has gone past the peak of the epidemic in recent days, and other French regions are set to follow the trend.
I'm afraid that the
International Labour Organization says the global job market will take longer to recover than previously thought, with unemployment levels set to remain above pre-COVID-19 levels until at least 2023. Due to the uncertainty about the pandemic's course and duration, the UN estimates the equivalent of around 52 million fewer jobs in 2022 versus pre-COVID levels, which amounts to about double its previous estimate from June 2021. Disruptions are set to continue in 2023, when there'll still be around 27 million fewer jobs. The ILO warns of a slow and uncertain recovery in its World Employment and Social Outlook report for 2022. Finally, China says Beijing's first locally transmitted case of COVID-19 in 2022, identified only 2 weeks after the last patient of the city's fourth resurgence, was discharged from hospital after recovery could be traced to a contaminated parcel sent from Canada. During a press conference on the city's epidemic situation, Deputy Director of the Beijing Municipal Center for Disease Prevention and Control, Pang Jingguo, says the infected patient received the parcel from Canada on January 11th and started to show symptoms on January 13th.
Well, for more updates and a better understanding of the pandemic, take a look at our website. It also has other stories, breaking news at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Wonwoka. Stay healthy.